this training is very important. Thanks to Pink African Foundation for organizing this training. It is very, very important. You'll be surprised that even a lot of cancer is still a strange, as common as it may sound, it's still a strange name, a strange disease. People still do not understand. Even the medical community are still trying to understand cancer. So now I'm going to call on the next speaker. So our next speaker is Ms. Kayla Kafka Peterson. Kayla is an oncology nurse and division supervisor, providing operations oversight for the high-dose rate brachytherapy program within the radiation oncology department at the University of California, Los Angeles. Kayla also serves as the nursing liaison to the board of the American Brachytherapy Society. As of 2024, she's the chair of the Nursing Dosimetry Radiation Therapy Technologies Council through ABS. Kayla has been involved in extensive education, collaboration, and networking globally within her specialty. She has also published numerous abstracts and presented for ABS, Oncology Nursing Society, JEC Estro, and also helped create virtual content for brachytherapy education throughout Africa through the support of Val Ventures for Global Health. Prior to her work in oncology, she was a trauma neurosurgical intensive care nurse in Chicago, Illinois, USA. I'm just going to add that she's a very brilliant person, so I can't wait for you to see and hear her. So Kayla, over to you. We're happy to, I'm privileged to have you. Thank you.
Thank you very much. Can you see my slides?
Yes.
Hey. All right. Again, thank you everybody for the honor of being able to speak with you today and for the invitation to be part of this tremendous program. As an oncology professional, it's just already been so enlightening, and I am very glad to be speaking on fostering patient and clinician relationships, especially after we just heard from multiple people who have been through cancer and are going through cancer, and cancer does affect all of us in some way or another, whether it's ourselves or somebody we care about, or of course the patients we take care of. I'm based out of Los Angeles, California, and I am at UCLA Ronald Reagan Medical Center. Disclosures, I have no financial disclosures. So there really is something very amazing about our jobs as clinicians. I'm a nurse. I know there are so many different types of people that are healthcare providers from, it's on my next slide, but the patients encounter so many different individuals as they're undergoing treatment and also as they're undergoing recovery. I mean, our relationship with patients lasts for years. And as healthcare providers, having relationships and conversations with patients is something we do every day. And I do think, especially when we're very busy, we'd often forget the tremendous impact that we do have on patients during this time. And even though it's what we do every day, we are encountering patients at some of the hardest, most traumatic, most stressful periods of their lives. And it is an honor and a huge responsibility to be available to our patients. Patients will remember what we say, what we do, and how we support them during this time. They will always remember that, whether it's good or bad. And we need to make sure we're bringing our very best. The clinician-patient relationship can become one of the deepest and most appreciated relationships for patients undergoing treatment for cancer, and can also become a profound source of strength if we bond with the patients in the way that they need. And it can also be a very cherished relationship for providers as well. We also have to take care of ourselves because it impacts us working in a high-stress environment with oncology patients, or in the past when I worked in trauma, it can be very traumatic as well. So it provides a lot of meaning and also can be very important for us as well as the patients. There was a paper that was published that even suggested that clinician-patient relationships that were positive can even have a slight effect on overall health outcomes. And there was a really nice quote, relationships between patients and healthcare providers have a healing quality, even in the face of therapeutic failure. And, touching on giving patients false hope, I think this is a really nice quote because even if patients are not doing well, even if, we know that we are not going to cure the cancer that they're undergoing, we still can provide them a healing relationship, even in the face of therapeutic failure. So many relationships do occur concurrently. Here's many examples. This is not an exhaustive list, but physicians, nurses, social workers, therapists, radiation therapists, chemotherapy staff, inpatient units or surgical units, mental health workers, front desk teams, coordinators. We all have our own relationship with patients. So nursing in particular, I speak from the standpoint of from a nurse and from a supervisor of a program. We have a lot of overlap with a lot of the other groups, and the nurses also. We have our own special traits as well. And oncology nurses are often one of the first and main points of contact for patients, and this relationship becomes critical for patients to feel support and continuity of care, empathy, and trust. They may only see their physician periodically. Again, it depends on the setup, it depends on the facility, but nurses are very often their main point of contact, one of the people they meet first and who they bond with very strongly. And emotional investment is considered to be a key necessity in oncology nursing. I think that's nursing in general, but I think it takes something pretty special to be a truly strong oncology nurse. And as it's been touched on in the previous conversations, oncology nurses, we need to balance providing optimism and hope while also ensuring that we listen to patients' fears and concerns, and again, not offering false hope. It is a balance, and it requires self-awareness and ongoing practice. So some barriers to forming healthy clinician-patient relationships in oncology. I think all of us could come up with this list on our own, but these are the things not to do. The things that cause an instant disconnect with our patients and ultimately the outcome of the relationship that we have with them. The biggest one to me, in my opinion, is lacking self-awareness on the healthcare provider's part. Not being aware of how we present, not being aware of our tones and the words that we're using and our focus on the patient. Not allowing time for questions during conversations, not appreciating knowledge the patient may already have. A lot of our patients don't know very much about their condition, and a lot of them have a lot of knowledge. And to just go in and assume they know nothing is not good. Dismissing or minimizing concerns is also very unhealthy. Stating overall plans without explaining the steps or the rationale. It's very one-sided, and it can make patients feel like their voice isn't heard or they're not part of the creation of their treatment. Not focusing on the conversation with patient as it's occurring. This is a big one. Obviously, taking a call, looking at your phone, not making eye contact with your patient. This is a huge one. Rushing or appearing that we do not have time. And this one, of course, time constraints for us as providers are incredibly real. And, especially in different areas of the world, it's even more disproportionate, the patient to provider ratios. So what I try to follow is if I can't help a patient in the moment, or if we can't help the patient in the exact moment, set a time or a plan for when they can have our full attention so that they feel heard. And then we need to stay true to our word. So learning to facilitate bonding with our patients in a healthy way. The basics, we really aren't ever taught this except for wonderful programs like what's being put on today. As part of our medical training, it doesn't usually involve this, medical training, nursing training. Self-awareness, again, is a lifelong learning process that will benefit us in our professional lives as well as our personal lives. Time and presence, just being with your patient and actually focusing on them. Compassion, again, empathy, the word we're seeing a lot today. It's very important. And respect and lack of judgment. Just listen to patients and hold off on any judgments. Maintaining eye contact and even positioning yourself at the same level of your patient seems to be beneficial, and allowing the patient to ask questions or state their fears or concerns without their concerns or fears being minimized. Connecting patients with additional resources. There's a lot of resources out there online, or social workers or therapists or nutritionists even. The support groups. There's lots of things that we can extend to patients as resources, especially online or printed if they don't have access to a computer, to help give them additional support. Also, re-explaining concepts to patients if they're confused without becoming impatient. This is something that frustrates people. You hear about this from healthcare providers, and being willing to re-explain concepts to patients if they need it or to their family is incredibly important, because often they are overwhelmed. It's a lot of information at once, and patients are doing the best they can. We need to be willing to re-explain anything that they need. Communicating with other providers on important updates and then letting the patients know that the conversation occurred develops trust. And this is something that nurses do a lot of, where we're all kind of coordinators in a way, with communicating with the physicians, communicating with the patients. I work in radiation oncology, so communicating with our radiation therapists, and then letting the patient know so they know that they don't have to send 5 messages or wonder if a conversation occurred. And then, of course, respecting cultural, ethnic, spiritual, religious differences to the very best of our abilities. So development of healthy boundaries is the other side of this coin. We can't be absolutely everything for our patients at all times, 24/7. We do have to establish healthy boundaries, both for the patients and ourselves. So relationships without boundaries can be detrimental, such as being personally available to your patient 24/7 for non-urgent matters. That's not to say not to have them have access to our team 24/7. You can give them after-hour phone numbers or the information for someone who's on call or a way to message us electronically, depending on the setup. But to be personally available to your patients 7 days a week, 24 hours a day, can lead to burnout. Patients asking for your personal cell phone numbers or other ways to contact you when work numbers are available. Patients requesting to meet you outside the healthcare environment. Of course, there are exceptions to this, especially patients we've known a long time. But on a regular basis, patients wanting to meet you outside of the healthcare setting when the healthcare setting is an option is a healthy boundary. And then also patients asking you to handle tasks or give opinions or answer questions outside of your scope or specialty. I've encountered this one a lot. The more experienced of a nurse I've become, I will have patients occasionally say, hey, my medical oncologist said this, or, what are your thoughts on, and it's something that is outside of my scope in radiation oncology. I'm not as familiar with chemotherapy. I'm not as familiar with certain elements of, surgical oncology. So I don't want to answer unless I know. So some things I can answer. Some things we just have to make sure we'll connect them with the correct individual. So things to do instead, just in summary, provide patient with phone numbers for contacting the team during and after business hours, providing them with emergency contact information and kind of define what's emergent. Provide them with work contact only, unless there's always circumstances where we make exceptions. Creating a safe space for your patient to meet with you at work as needed. And then again, if the patient is asking you to advise them on something outside of your scope, it's important to set a boundary that you're unable to answer yourself, but that you will do something about their question and will connect them with the right individual or resource. So fostering trust is very, very important and a huge theme of our agenda today. As oncology nurses or healthcare providers, we must stay true to our word and create the opportunity to be available to our patients. If we state that we will contact them, connect with them with a resource, relay their messages, or be available for them at or by a certain time, we really need to make sure that we do so, even with the very real-time constraints that face healthcare providers. Reminder systems are very helpful. I have to set alarms or timers on my phone that works for me. If I tell my team even I will be back in 1 hour, I set a timer for 1 hour, to provide a break relief in the operating room. Or if I tell a patient I will call them by the end of the day tomorrow, I will put a reminder on my calendar and set an alarm on my phone. That works for me, because otherwise I will forget. We get very busy, but everybody has their own system, and finding one that works for you helps so much, for you to remember to take 5 or 10 minutes to do what you said you'd do. Using closed loop communication with patients to minimize chances of understanding is also very important with building trust. And then documenting all conversations, depending on how medical records are kept, some are electronic, some are still written, other ways. it provides continuity not only for you to recall exactly what you spoke to the patient about, but also if you are gone and your colleague is, taking a call from the patients or seeing them, they can review what was discussed and pick right up from where you left off. And then again, if we don't know the answer to something, we need to say so. I think there's something very powerful in saying, I don't know, but I'll find out. That actually helps build trust and humble relationships with our patients, because we will never have all of the answers, but we definitely have the ability to help them get the answers that they need. This is a very wordy slide, but this is one of my favorite things that I've learned during my time as an oncology and as a trauma nurse. Personality assessments, kind of a big leap, but an interesting approach to improving our ability to connect with patients and also with people. Our personality assessments, there are so many ways to do this, so many free ones online. It almost sounds a little bit self-centered, but there is a huge difference between being self-centered and being self-aware and always working on that. They're actually very, very different. I took a personality assessment when I went into leadership. It was something that was offered by my facility that I was very grateful for, because it pointed out my strengths. Some of them I knew about, some of them I didn't. And it pointed out my things I was not as strong in, some of which I knew about and some which I didn't. And that not only helps me as a nurse, it helps me as a mother, it helps me as a family member, and it helps me as a supervisor. So our strengths are usually how we will most easily connect with others, and we all have our own individual strengths. And if we protect and foster and grow these strengths, their value will add so much power to our relationships with our patients. And examples, there's so many different personality traits, but let's say you're someone who is very organized, punctual, detail-oriented. Patients trust these people very quickly. These individuals make great patient coordinators, great any role, but front desk team members, nurses, schedulers, attention to detail really is a great thing with patients. For people who are naturally warm, friendly, outgoing, or extroverted, this helps break the ice with patients. Other people who are introverted, this might be something they struggle with. Having high analytical skills. Some people are great with data and are very abstract thinkers. Some people are very literal. I happen to be one of the very literal ones, and I struggle with analytical skills. But for people that are strong in it, it's great in leadership, quality improvement projects, research, the list goes on, and there's a lot of positive personality traits. Our weaknesses, it's important to remember these are not faults. We do have to consider, however, if they are negatively impacting our ability to connect with patients or others, and also how those relationships affect us. And this is where I say focusing on building self-awareness is a lifelong thing, and it can be so beneficial. And if we can focus time on energy to researching what our weaknesses are, developing skills where we need it, it can change our lives, both at work and not at work. Such as if you're naturally empathetic, taking on others' emotions, that's not a weakness, that's a beautiful thing, but it can lead to emotions and stress following you home. It can contribute to burnout. It can make you say, it can emotionally impact you where you cannot do your job as well as you want to. If you're naturally disorganized, it could decrease your reliability with patients as tasks or commitments might be forgotten. So figuring out a way to work on that will help your bond with patients. Also, fearing conflict or uncomfortable conversations. This is a very common trait for a lot of people. It's normal. We have to work on it, but the downside is if we don't, it could lead to difficulty having those challenging clinical conversations, especially in oncology, and supporting patients when they need us. We have to be able to have those conversations with them or support them in those conversations. Another very important slide is the importance of taking care of ourselves. This is something that finally is starting to be talked about, but only very, very recently. And as an oncology nurse, this is something that I really value and try to prioritize. I learned this a little bit late. I did not realize the importance of this when I was a trauma intensive care nurse. And I had 6 or 7 years of incredibly, just work was very, very heavy, and we were seeing incredibly violent things. And I didn't really realize that I needed to have an outlet. I just kind of tried to keep going. I was a new nurse, and I think eventually when I got very tired and realized I needed to figure this out, I reflected on it and I was like, we were never taught about this, and it's not part of medical training. It's not part of nursing training, but it is so incredibly obvious and important. So I definitely want to touch on it today. Providing our time, our energy, our effort, our attention, caring, compassion to patient, it does create output exhaustion if we do not care for ourselves in addition to our patients. We have to figure out a way to recharge or process somehow. Prioritizing our own mental and physical well-being is so important if we are to then bring the best version of ourselves to our oncology patients every day. And development of healthy outlets for coping. That looks different for many, many people, but finding what works for you and making sure you prioritize it despite our very busy days, even if 50 minutes a day can make a difference. It is very overlooked. Our inability to create healthy outlets can lead to burnout, lack of empathy, lack of connection, and ultimately the turnover and loss of many very, very qualified healthcare providers. And developing healthy coping mechanisms can increase emotional resilience and our ability to deliver exceptional care to every patient every time. And that's what they need during, every encounter. It's our responsibility to not only do this for ourselves, but also to encourage people we are training in the healthcare environment to do the same, to let them know that this is okay to talk about and actually incredibly important. And if anybody ends up in a management role, making sure that we support our, the people that report to us, their personal lives as much as possible to help make sure that they can come to work okay. But again, time constraints and provider shortages are a very real issue. So it's a balance. I'm still trying to figure this one out. I think we all always are, but I think it's incredibly important to talk about. So in summary, as oncology professionals, we have a tremendous opportunity within our work to build true connections with others during what are likely their greatest times of need and support in their lives. This is a privilege for us. This is an honor. It's a huge lesson, and it's a gift. And we must also not to forget to take care of ourselves in addition to taking care of our patients. I, again, will always advocate for trying to develop our own self-awareness, foster and harness our strengths, and learn about our weaknesses as part of our ongoing commitment to provide the best clinician-patient relationships possible. And this is a lifelong journey that will serve us both in our professional and in our personal lives. Clinician and patient relationships should always be protected and prioritized as one of the most critical aspects of cancer care. Thank you very much for your time. There's just a couple of references there.
Thank you, Kayla. Sweet Kayla. Thank you so much.
Thank you for having me. And hello
for your
from
wonderful presentation.
Hello from California.
Oh, thank you. And I know it's very early for you, so thank you for waking up early to do this presentation. I have a comment and there's a question in the chat. Because of time, I won't be able to take too many. So while you were talking about burnout, I already wrote down that I was going to ask a question about burnout. Then you went to that slide, and I was thinking about our nurses here in the clinic. They are short-staffed, and then you have this many patients. So sometimes you really want to be nice and speak so kindly and want to attend to everyone. How I don't know I don't know if you'll be able to answer that question. How in that kind of situation, how do they manage burnout?
Burnout is a very, very real thing, and I think it gets worsened when there's a shortage. And I know in a lot of some centers have more nurses per patient, some have less. But I still think whether you are interacting with your patient for 5 minutes or 10 seconds or 30 minutes, which is very rare to have that much time, even if it's a minute, the fact if you put down what you're doing, make eye contact with the patient, make sure that they understand that you're there, just little things like that, you still can have an impact on those patients, even if you are doing 50 other things and taking care of other people. And also setting the proper expectations with the patients too, just saying, I don't have time today to do X, Y, or Z. I'll spend 5 minutes with you. We'll try to connect by the end of the week. But it is, and it's one of those things that you always go home wondering if you did enough or wishing you could do absolutely everything for everybody. And it's not realistic, but we still can do things in each moment to maximize how we're interacting with not just our patients, but with each other, with our staff, with our supervisors, with every being present and being self-aware. Every moment can actually be very good. It's It takes practice though. I'm definitely not an expert in it, but I do make a big effort to do so. And I find it helps me outside of work too, especially like I have a little girl, and like even just my moments with her and I'm doing a bunch of things, I try to just focus on that, even if it's for a minute. So the burnout's very real. And I think mental health and self-care really only in the last 10 years is it really starting to be talked about. And I know it's gaining traction quicker in certain areas than others, but I almost left nursing, and I'm okay to say that. When I worked in intensive care, because I didn't think I could handle it. And I realized I didn't have any outlets and I wasn't taking care of myself. So once I made some changes there, nursing has become one of the best decisions of my life. And I'm so thankful that I'm a nurse. So
Yeah, we're happy
I
that
definitely
you're
wanted to include it.
I can't imagine you doing something else. And we're happy that you're a nurse. Thank
I
you so
love
much.
it.
That's the very point that you have just mentioned. And there are many people like that, I'm sure. Not even not even nursing alone, even in other professions. People
Mhm.
have, there have been times you just want to throw in the towel. Because
There-
of time.
oh,
There are
I'm,
some
I'm so
questions in the chat, so I would like you to please just respond to them. There are lovely comments about this presentation. It's an eye-opener to everyone, not to health professionals, nurses, and non-medical professionals. So please just scroll to the chat and then answer the questions. Onyeka, your hands are up, please. I'm sorry, we won't be able to take you. Just type your question in the chat and Ms. Kayla would respond to them. Thank you so much for the wonderful presentation. And we hope that when next we have a program, Pink Africa would love to invite you, and we hope you would accept their
I would love
invitation.
to. Yeah, I'm on board. It's wonderful to get to know Pink Africa, and thank you again for this wonderful opportunity. I'll take some time to answer in the chats now.
Thank you very much.